It's been exactly a year since Ebola was declared a public health emergency in Guinea. To date, more than 10,200 lives have been claimed in what has been the worst epidemic of Ebola the world has seen. Now, teams from Médecins Sans Frontières have and still are heavily involved in fighting the outbreak, which remains out of control in some areas. Today, MSF will release a gripping report looking at the pressures and the tough decisions the organisation has faced responding to the deadly virus. And to talk to us about some of the insights of this report, well, we are joined in Cape Town by MSF's Medical Coordinator, Dr. Gilles Van Cutsem. A very good morning to you, Doctor. Thank you for joining us once again.
Good morning, Eben. Thank you for having me on the show.
It's hard to believe that a year has passed. It seems so quickly. But before we look back, Ebola is still claiming lives in countries like Liberia, Guinea and Sierra Leone. Where are we right now in the fight against this deadly virus, Doctor?
Well, we are still at 150 new cases in the week leading up to 15 March, mostly in Sierra Leone, hotspots and in Guinea. Although very sadly, there's been the announcement of one new case in Liberia during the weekend. This is still a level of transmission that is higher than any previous outbreak. So there's no reason for complacency, and we need to keep up the effort, even if there is a positive decline compared to what we had in the middle of last year. But it's still very high ongoing transmission.
Now, Doctor, a year on exactly today, you're about to release a report a little bit later this morning outlining where you are and what you'd like to see happen. What are the key points in the report that you'd like to make public?
I mean, the report is a reflection on, as you say, on last year, looking at a very sad anniversary, 25,000 cases, more than 10,000 deaths. This should not have happened. It's the result of very serious neglect by the international community, which only really started to respond in October, November. It's been very tough for MSF and for ministries of health in Liberia, Guinea, and Sierra Leone to carry almost the entire response on their shoulders during most of the outbreak. This should not have been like that, and we are definitely calling for, in the future, to create an international outbreak response capacity that can prevent this type of getting out of hand of the epidemic as we've seen today.
Doctor, you guys at MSF, you knew immediately on the ground that this outbreak was unprecedented, unlike any you've seen before. It was a claim that was rejected immediately by the World Health Organization, I must add. Just take us back to the beginning of it all. What were the early signs that showed you guys that this outbreak would be unlike any other?
I mean, all previous outbreaks were mostly confined to rural areas. Had less than 500 cases. Very rarely did they reach a capital. In March, when the outbreak was discovered, it was already present in 4 different prefectures in Guinea. It had already reached Conakry. So we were dealing with a very scattered outbreak, unseen before. It was clear that this was going to be an outbreak that was going to be very difficult to respond to. On top of that, it was on the cross lines between Sierra Leone, Liberia, and Guinea in an area with highly mobile populations going through porous borders, making inter-country coordination essential. So this had all the signs of being a very difficult outbreak, needing a massive response from the beginning.
Doctor, in April of last year, April, May, somewhere around there last year, when you guys at MSF warned that this epidemic was threatening so many lives, you were called out to be alarmist by the World Health Organization. The response that followed, the international response, was quite sluggish, if to be kind to the international response. What would you say was the overall effect of this slow response initially?
I mean, the overall effect of the slow response very clearly let the epidemic go out of control. It was impossible to control it with the means on board. Only private aid organizations and very weak health systems in the region. The fact that the response came so late is the direct reason why we've had so many cases and why it has been so difficult to control. The example of Liberia today shows that with a vigorous, robust, flexible, rapid response, you can decrease the number of cases. And this is what we need to do now for Sierra Leone and for Guinea as well.
Well, Doctor, thank you for joining us today. You guys have done a fantastic job as Médecins Sans Frontières in curbing the collateral damage in these countries and stopping it from being spread around the rest of the continent. That's Dr. Gilles Van Cutsem, who is the medical coordinator of Médecins Sans Frontières here in South Africa. Let's have a